All right, so we are live. We are here, skeenastrong.com, and our episode 9 of Fighting COVID in the Skeena. My name is Dan Messick. Thank you so much for joining us. Of course, this is our episode number 9, and officially we have been running these episodes of Fighting COVID in the Skeena for a year. It's been a full year of these episodes, so thank you so much for those who have joined us over this past year, over the last 8 episodes, and hope to see some questions in the chat box on Facebook for episode 9. Today we have some great guests with us that we're going to get into a few issues. Of course, the issue of the day, these vaccination cards, immunization cards that are going to be required in many places, many public places, restaurants, gyms, any indoor activities and events in 4 days. So on September 13th, we're going to see that go live. So we're going to dig into a little bit about what that means for you and your family at home and across BC, and especially here in the Skeena as well. We're also going to take a look at the current situation with COVID-19 across the board, what we're seeing some places in around the globe, as well as here in Canada, and especially in BC and in the Skeena. As well, I just want to note, anybody who is joining us tonight, please put your questions into the chat comment box on the live feed on Facebook, and we'll try to get to those as well. We do not tolerate any discrimination or abuse or harassment in the questions at any time, so please be respectful with any of your questions and comments. And with that, I am going to kick it over to my co-host as usual, Christine Smith-Martin. Christine.
Thanks, Dan. I can't believe it's been a year. I sort of reflecting back on all the episodes we had when we were talking about those shoots for the Halloween distribution of the candies, and then Christmas, and then school, and it's been quite the journey. And thank you to all the people that have been watching, and we've had some great uptake on our website, so we really do thank you for supporting, and all of our guests that we've had in the last year. Thank you. You've brought in excellent information to the Skeena, and been a great supporter of the work that we're doing here. We're very excited. As we mentioned, my name is Christine Smith-Martin. I'm coming to you from the beautiful Squamish, Musqueam, and Tsleil-Waututh nations here in Vancouver. But before we begin, I just want to take a moment to acknowledge passing within the Indigenous community that we've had on the coast here. A very great man, Chief Edwin Newman from the Healthchuck community, has been an amazing ambassador and a great voice, not only for his nation, but for all the nations along the coast and in BC. It's been a great loss, and sending lots of love and support to his family and his nation at this time. I just wanted to take a moment to acknowledge that. We're very excited. Like we said, it's been a year. We have some excellent guests tonight. We have Honorable Nathan Cullen, as many of you know, MLA for Skeena region. We're very excited to have him, and he'll talk a little bit about what's happening in the provincial government, and we have a great conversation. And also returning back is Dr. Jason, is an infectious disease researcher and a professor at the University of Manitoba. Thank you for coming back, Jason. We're very excited. So I think we'll start off with Honorable Nathan Cullen. I know that this new immunization card the days are ticking until we have to have it loaded up and to utilize it in some of the restaurants. I'm wondering if you can give us a sort of update what's happening on the province.
Sure. So first of all, thank you for the very kind invitation to come and talk about this issue and answer questions from yourselves and from the public. I'll try to sort of go briefly, and then we could probably in the conversation explore some of the nuances about enforcement and application. But essentially, as of September 13th, which is just 4 days from now, The BC government gave notice some days ago that we would be moving to the BC vaccine certificate. The reasons for this are pretty straightforward, actually. That our primary goal is to keep people safe. We also want to keep businesses open and going because they're the lifeblood of many of our communities. And we don't want to overwhelm the healthcare system, particularly our hospitals and ICUs. And those are the priorities that we have in mind when talking about showing proof of vaccination in these particular places. So you've mentioned some of them already. Restaurants, these are high transition places. These are places that for various reasons, either masks can't be worn, or we've seen in the past, this is where some outbreaks tend to happen. So movie theaters, restaurants, bars, indoor concerts of a certain size, and gyms, health clubs, spin classes, that kind of thing. We know there is low vaccination rates, as Dan talked about earlier, within some groups in the Northwest. Some communities are very highly vaccinated. I'm thinking Kitimat and places like Prince Rupert. Some subgroups of our population, particularly First Nations and some others, are very highly vaccinated. But as a region and in certain places, we have a very low vaccination rate. And we're seeing the vaccine number, the COVID case counts go up in some places. Overwhelming number of people who are ending up in hospital are unvaccinated. Some people are calling this a pandemic of the unvaccinated, but it's not my favorite term, only because in a pandemic like this, I believe that we're all affected. We can't simply say, well, I'm vaccinated, I'm not likely to end up in hospital, so what have I got to worry about? There are a number of people who can't get vaccinated, especially children. And so this is a way to encourage people to get vaccinated, but also let you know that if you are vaccinated and you go into one of these places, people there that are with you are also vaccinated, that you're not worried that somebody is not. People can go online at gov.bc.ca/vaccine card. There's a 1-800 number. You can go to the local library, the service center. All of these places will help. You get either a digital certification card, or you can print it off, or we can mail you one. So we're trying to make sure that people who aren't super comfortable with smartphones and whatnot can also get a vaccine card. We'll talk about some of those other things in terms of the risk, but that's what's happening. It's starting for first dose on September 13th, and then a little bit later in the calendar, second dose. And that's what the vaccine card will show. You've got 2 doses, you've got 1 dose, or you've chosen to this point not to get a vaccine.
So have this been done in other provinces, or is that where the sort of idea came from, looking at other provinces that it's been successful in?
Yeah, well, we've noticed, a couple things we've noticed right out the gate. I mean, different states, provinces, countries have tried just about everything under the sun to improve vaccination rates, because we know vaccines are our best tool in terms of beating this virus, which is what we want to do, right? At the end of the day, I think we all have this in common. We understand this is a deadly virus. We understand it's had a crushing effect on people and our economy. It's cost billions and, well, probably trillions of dollars globally. Some jurisdictions have offered money for people that, Alberta, for example, recently offered $100 for lotteries. Those have been not very successful in terms of upping vaccination rates. BC has a pretty high vaccinating rate right now compared to some jurisdictions. We've had a relatively low mortality or death rate compared to other jurisdictions. In terms of vaccine certification, yes, it seems that other provinces, Quebec, Ontario, and some others have moved in this direction. And folks will probably want to know that some of the call for us to do this as a government came from the BC Chamber of Commerce, a number of our sports teams, arts groups, because they didn't want to be left with some kind of hodgepodge system where they had to invent rules as individual business owners to then try to enforce without having the full public health order and something consistent across the board. And so I know there's concerns from some of the business community, but ultimately we've seen what shutdowns look like. They're devastating, they're isolating, they're hard on our communities. We don't have to imagine it, we've experienced it, and we're trying to avoid it.
Excellent. Thank you, Nathan. I perhaps want to bring in Jason in this conversation. Jason, so maybe you can share with us, what are some of the trends that you're seeing in the last couple of weeks?
Yeah, it's been really interesting, right? So, the US is now starting to plateau a little bit and actually even drop in some of their jurisdictions. They got hit very, very hard with this fourth wave with Delta. Certainly, areas in the southern states that had lower vaccination rates, we're still watching a lot of the impact from that in regards to hospitalizations and certainly, ever increasing mortality within those areas. Canada's been a bit of a different perspective, right? So we've been lagging a little bit behind, whereas certainly in the third wave, we were actually a little bit ahead of the US in regards to where we were in cases. But it's been very much region to region in regards to what phenomena we're seeing. So here in Manitoba, cases have been fairly low. There's been maybe a little bit of an uptick, but not that much. So the trend is generally starting to increase a little bit, but it looks like we're actually doing okay. The province that I just came back from spending 12 months in Saskatchewan, they're in a lot of trouble right now. Certainly in terms of ICU capacity, they are stretched to the limit. And there's another case where they did not have a particularly bad third wave, but the fourth wave has certainly caught up to them very, very quickly. Alberta is very much a big concern for us. Certainly watching the pleas coming out from people that I know that are in healthcare directly. They're in a lot of trouble, and the problem is there isn't any real change right now in the trends in cases. So everything continues to look like it's rising exponentially, and the problem is that we know that as cases are increasing, hospitalizations aren't necessarily increasing at the same time. They're going to lag a little bit behind. So if you're still watching trends increasing and you're already maxed out in terms of ICU capacity and hospital capacity, you don't have that, that kind of, sunny demeanor to tell you that, things are starting to plateau and things are going to change. BC cases are plateauing. But again, I think our concern, is very similar there as it is in Manitoba, where we have jurisdictions in the south of the province that have low vaccine uptake. With Delta, this particular variant, we know it transmits very, very quickly. We certainly know it's moved very quickly into communities that have low vaccine uptake. So I think our concern is that, we have a really good buffer in regards to people that are vaccinated in a lot of major locations in Manitoba. But if it gets into those low vaccine communities, really the concern is that it's probably going to put a lot of people into the hospital very quickly, and we have not recovered yet from the third wave. So again, we're not dealing with being at baseline and then bringing people into hospitals. We're dealing with already just starting to get back close to normal, but now any exacerbation is going to put a lot of limitations on not only people that need COVID care, but also other communicable and non-communicable diseases.
Well, it's an interesting time now because here in BC, we've just started back to school. My grandchildren went off to school, and I'll be honest, I'm a little bit scared. And, I'm always telling them to wash their hands and keep their mask on and all of those pieces. So I'm wondering how is this Delta variant going to, or how do you think it's going to impact kids that are going back to school, and what would that look like?
This is a great question. It's a controversial question, right? Because there's been this perception really from January 2020, when I think back to when I was still in Kenya and we were watching things unfold in Wuhan. There was this perception that this is a disease that seems to very much be polarized towards people that are elderly or people that are in very high risk categories as far as underlying health conditions. But younger people, it looked at that point like they were almost refractory to getting sick. Well, that hasn't been the case, right? I think what we've seen is that certainly if you put younger age groups into the path of the virus, we may see lower cases of infection, but we certainly still see people that are getting sick. With Delta in the US, the trends have been concerning, right? We're seeing certainly the greatest number of kids that have shown up in hospitals all through the pandemic. Now, it certainly is not at the level of what we've seen with adults, but it tells us that if we put kids into the path of Delta, they are going to get infected and they potentially could get sick. So I certainly appreciate it. I've got a 3-year-old who's in daycare. She's certainly in a group where she likely is not going to get infected or not be impacted by the virus. But as a parent, I'm also concerned. Certainly this is, probably our most precious commodity when we think about those around us and the people that we want to protect the greatest, and the people that are probably the most reliant on our protection. And how do we do that? This virus, if it's taught us anything, it's been unbelievably resilient in being able to get around barriers. So it's not just about vaccinations. It's about masking. It's about ventilation. It's about distancing. It's about hygiene. It's about all these different aspects together. And Delta has pushed that limitation higher because, again, it's able to do what the original virus was able to do, but actually do it much more efficiently. So I'm concerned. I think we're going to see more kids that are going to get sick. I think we have a number of tools, though, that we can put in place to try and protect them. But honestly, our greatest tool is getting people vaccinated. Communities that have had high vaccination rates have had lower cases of infections in kids as opposed to those that were unvaccinated.
Yeah. And I just want to point out, we've definitely seen or possibly have seen some of that taking place in the region here. The numbers that have come out from the CDC in terms of the local health areas, they put them out on Wednesday afternoons, and it's always the previous week. So we're seeing here in Smithers, we're seeing about 45 cases according to the CDC. Also, one primary care facility here has said it's up to 64 now because it does lag a little bit behind. And so we're clearly seeing the uptake. Here we have a lower vaccination rate than a place like Prince Rupert, which is seeing fewer cases, as well as Kitimat seeing fewer cases. And so at the time where vaccination rates are starting to kick up, we are still seeing in some places, in some communities, still a low rate or kind of a mediocre rate, and need to get those up if in some way that is going to correlate. We do have a couple of questions coming in here, and one from Joan Leclerc that I'm going to kick to Nathan. Obviously, restaurants, gyms, any sort of indoor gathering, theater, movie theaters all require this immunization card or records come the 13th. But Joan Leclerc is asking, will staff at these restaurants, gyms, and other places be required to be vaccinated? And if not, why?
Yeah, that's a great question from Joan. It's something we've looked at. Options remain open, but as of right now, no. Every business that operates, any of the ones that you named, has to have their own procedures in place, both to keep their staff safe and also to try to keep customers safe. And we've seen that, the plexiglass or plastic in between, the mask requirement that we have going right now. And so those protections are believed to be sufficient. The challenge, of course, is when you come into a restaurant, you as a customer take your mask off to eat. When you're in the gym, I was in a gym just a few days ago. There's a mask requirement. Some people are, some people aren't. The enforcement is challenging. And in a darkened movie theater, also challenging, right? So we haven't required yet people who are doing the serving or welcoming people in to do it, but we encourage everyone to get their vaccine if they choose to. And we strongly encourage that because, as we've said, it's the best tool we have available, particularly for somebody working in a high traffic area, right? That's somebody who's working in a very busy restaurant or in a gym that's got a lot of people in it. Keeping yourself and your family safe, vaccines help you do that. And so we want to keep people safe. That's why we made sure that if people feel sick, they had paid sick days to stay home so they don't, again, bring the disease in and make more people sick.
I see some of the concerns about enforcement of the mask, and I've certainly seen on the news media some of the incidences that have happened. Is there anything specifically set up to assist in the ensuring that everybody is masked up?
Yeah, people might remember we had an incident in Smithers some months ago where somebody, I think, was trying to make a point and really was quite belligerent and aggressive towards staff at the local credit union. Taking it out on staff, I find incredibly misguided. If someone has a problem with the vaccine requirement, that was issued by the public health order, they can talk to me. They can phone me. They can engage in these types of sessions, yelling at some poor store clerk. We've seen some violence in some other communities going after people just on the mask mandate. So I can understand the apprehension, as is the case with anyone anywhere who's belligerent like that, threatening or being violent, whether they were upset about a vaccine issue or were drunk or anything. We ask people to contact the police. We don't want somebody at a restaurant getting hurt or having to face that kind of abuse at work. And if you've ever been a server in any kind of restaurant, unfortunately, there's always been people who think they can be that way towards the staff, who are simply following whatever rule, not serving someone once they've become too intoxicated. Someone walks in with no shirt, no shoes, they don't get service, and they can yell and scream about it, but they got to leave. And if they go beyond that, then shut the place and call the cops. It's unfortunate, and I know that worry is out there. I guess I'm saddened by the fact that in our communities, even the conversation around these topics has become somewhat violent. You know, people can have very strong passions, and I want to respect those. But the facts are the facts. And if you're 12 times more likely to get COVID without a vaccine, if you're 34 times more likely to end up hospitalized without a vaccine, if you're 8 times more likely to die without a vaccine, those are the facts. Those are the stats. People can argue all sorts of things, but it's very challenging for me when they want to argue on those things. So let's protect each other, and let's certainly not be aggressive towards the people who are simply doing their jobs. And unfortunately, like I said, that's been true in any time a bar has ever been open. There's that risk, and we tell staff, as any good manager would, don't engage somebody if they're being verbally abusive or threatening physicality. Call the manager, get out of the way, and call the police if required.
Clearly going to be some challenges there going forward. Believe it or not, I used to work as a bouncer at one time, and on a good
hard
day,
to believe, Dan.
Yeah, hard to believe. And on a good day, it's hard to deal with people who are drinking and carrying on.
Sure.
Never mind with requirements like this. So we'll see where that goes. I just wanted to jump in. I do have a question from Curtis England, more of a question for you, Jason. His question is that he's been watching the data coming out of Scotland, and it's showing vaccination efficacy is waning quickly in the 60+ age group, which is the highest at risk. Infection rates, hospitalizations, and death rates are rising weekly in that group as well. How will the vaccine passport stop the breakthrough of transmission? So what do you take from that?
Yeah, it's a great question, right? So listen, Delta has certainly really changed things for us. When we look back at the original virus, we can base our idea of herd immunity on the transmissibility of the virus. So we start to get a sense of, where do we need to be in regards to immunity and protection in our communities to try and cut down transmission. Well, Delta has changed that for us. Certainly, it's put us up, around 90% or 90% plus. For herd immunity, and keeping in mind that herd immunity is, it is not a hard and fast number. So what we basically are left with is this idea that we need to get immunity as high as possible in the community, and that will help subside transmission. Now, we know at the same time, we're getting data in real time in regards to what immunity looks like in regards to the, how long of an immune response somebody will be able to carry, or how much immune memory somebody will have over a period of time following vaccination, because we are using these vaccines for the first time. I think we're already seeing data that suggests that in higher age groups, we do see some decrease in effectiveness of the vaccines. Certainly in regards to being able to block infectivity, we are seeing that, but to be fair, with severe disease, we are still seeing good protection from severe disease, but we're seeing that discussion right now about third dose boosters for high risk groups. And I think that the likelihood is we are going to see those implemented soon. So where I sit on this idea of immunization records and trying to get those out in the public is, if we can get enough protection built up in the community, specifically around those people that are in higher risk groups, regardless of what their vaccination status is, that's going to help us buffer and decrease community transmission. So ultimately, those people are going to have an added layer of protection by our own ability to get vaccinated, decreasing transmission rate in the community, and also allowing them to get third dose boosters. So it's disheartening. I wish the vaccines were, we weren't seeing any evidence of waning. I think certainly the data is still coming in regards to how much waning we're seeing. But we've got to build up protection. I don't think we have a choice at this point.
Well, it's been interesting to talk about that third booster shots when, we're in some of the world, they haven't even got their first one. So that's been an interesting topic to sort of follow. But I think that's the concern too, as well as you have a compromised immune system. How long does it sort of stay in your system? But one of the things I've been watching is the vaccinated people that are getting sick and ending up in the hospital, watching if there's any sort of increase, because that virus is really sort of mutating. Do you have any information on that? Is that number steady?
It's pretty steady, right? And I say that from the sense that, listen, if we look at numbers on a daily basis and we just look at the total number of cases in our communities, what's going to happen over time is that as more people are vaccinated, we're ultimately going to see more cases that show up in people that are vaccinated because there's a greater proportion of our community that is now vaccinated. But what we have to try and not get caught up in is just looking at that top numbers, just looking at the total number of cases. What we have to think about is, well, how does that relate to the total number of people that are immunized in our community? And that will start to give us a sense of what breakthrough infections look like. So how many infections are we seeing truly in people that are vaccinated? And what we tend to see is that there is still a massive difference between infections in people that are unvaccinated versus people that are vaccinated. And really, when we look again at the trends in regards to severe disease and hospitalizations, we haven't seen strong shifts across communities, whether it's from the US or Canada or otherwise, in changes between that shifting from unvaccinated now to being represented by vaccinated people. This is still very much a situation where people that are unvaccinated are making up the vast majority of those cases that are ending up requiring supportive care.
No doubt. We do have a couple other questions here. One that I know has been burning for a lot of people, so I'm going to ask it to Nathan, and then we're going to take a look at some slides. We're going to kind of frame this up in terms of what we're seeing globally and then nationally, and of course here in BC and in the Northwest and the Skeena region. So this is coming from Miriam Delicado. She is asking about the clear guidelines. Are there clear guidelines for when and how this vaccine card will no longer be needed? I know that there's a kind of a deadline in January 2022, but maybe you explain a little bit more in detail what those clear guidelines are, and could we expect to see this past that date?
There's been many challenges going through a global pandemic. The main one has been predictability, right? That when we all first heard about COVID, if somebody had said, 18 months from then, 2 years from then, we'd still be consumed with this conversation. And I don't know what the global figures are now. Some 5 million people plus have died, billions and billions spent. You would have been very smart. Most people, maybe outside of some pandemic experts and virologists, wouldn't have been able to predict it. So this idea that the large part of what we're doing right now is to bring the vaccination rate up. And I think it's important to look at that, 77% of British Columbians able to get vaccinated have gotten both doses, right? But to get those effective rates where the virus is not spitting around the community, causing all of this damage and hurt to people, it seems like we got to get it up. And we always knew that the first 10% of people getting vaccinated was going to be a whole lot easier than the last 10%, right? That's the nature of people. There'll be reasons and concerns. So yeah, the current plan is to take it to January. I hope, along with everybody else, that our vaccination rates are up, that our COVID numbers are down, and then we can say the passport is no longer required We don't need to be showing these proofs. And that may be some other limitations that we've been looking at. But from the very beginning of this, our government said we were going to follow the advice of the public health experts. We were not going to politicize this. We were not going to put our fingers on the scale one way or the other in terms of making these decisions. And that's given me, and I think a lot of other people, a lot of confidence that the measures that we're taking have one goal in mind, which is trying to defeat this virus. And it has proven to be an incredibly difficult foe. It is mutated, it is challenging, it has become much more transmissible, and it is deadly. And it's not just affecting those who get it. As any doctor in the North will tell you, any doctor anywhere will tell you, that it is crowded our hospitals, sometimes at near crisis levels, and pushed other life-affecting surgeries and appointments out of the way because there just simply isn't the room. And it's filled up ICU units. I mean, this is intensive care units. So to the short answer to the question is that is the current plan to take us through to January. It'll be based on the numbers. It'll be based on the scientific advice. It won't be based on politics or somebody's opinion. It's the numbers. And if we can get people vaccinated, if we can bring transmission down, if we can keep more people safe, keep our businesses open, then the passport, the vaccine certificate will no longer be required. If not, then people have made a choice, and that'll be in a more difficult way.
What has been the uptake in BC in regards to the vaccine certificate?
Dramatic. It's been and especially compared to jurisdictions that have used other incentives like the $100 in Alberta or get your name put into a lottery for a prize. We've seen a dramatic uptick. I think it was 4 times out the first week, like 400% increase, then down to 200. I could check the latest numbers from the public health office, but there's, I guess, within those that are have chosen not to get the vaccine so far, it's not one group, right? From my perspective, I don't think it's a whole group of people that think exactly the same way. I think there are those that are just opposed no matter what. They're just not going to do it. They will never get a vaccine, although people get vaccines all the time, and and we have vaccine cards and proof of vaccination status for our kids to go to school, but okay. I think there's another group that have been worried and have had concerns, or another group that just hasn't been bothered because they thought everybody else was getting vaccinated and so they didn't need to. I think it's those last 2 groups that are of particular attention, who've realized if they want to get on a plane, if they want to go to a bar, if they want to go see a movie in a theater or eat a meal out, they're going to have to get vaccinated. If you choose not to get vaccinated, you're getting takeout and you can watch Netflix. And, those are limitations on those liberties, but we have lots of limitations on our liberties that we do to keep people safe. And that's what this is about.
I want to switch over. So we're about halfway through our show. If you're just joining us, thanks so much for tuning in. Skeena Strong. This is Fighting COVID in the Skeena, episode 9, and we have both our 2 experts here, Jason and Nathan. We're going to take a quick look at some slides here that will help illustrate kind of what's going on globally here in Canada nationally, and then we'll localize it to BC and what's happening here in the Skeena region. So if you just bear with me here, I'm going to share my screen, and hopefully you can all see this. So we're taking a look at the daily new confirmed COVID-19 cases per million people, and as you can see, in the UK, we're seeing about 560 plus cases per million people, 450 cases in the US, and here in Canada, we're about 100 plus cases per million. So currently, that's the situation globally as opposed to Canada. And if you'll notice, just take note, back only a few months ago in May, we were all kind of tracking around the same. Since then, Canada has done fairly well as opposed to the other 2 countries. However, we're starting to see an uptick in cases nationally. So definitely some more work to be done here. On slide 2, taking a look here at the picture in BC. So these are new daily cases per 100,000 people on the 7-day average. clearly, Northern Health and Interior Health are the highest. Northern Health taking just above Interior Health with 280 plus cases per million. So if we did the math per 100K, so that equates to about 280 plus cases per million. So quite a bit higher, even with taking a look at the national rate. And of course, the average here in BC, kind of about in the middle. So we're looking about 10, 15 cases per 100,000 people. So definitely something going on there. I'm just going to flip this over to Jason very quickly. What are we looking at here, Jason? If you can kind of explain a little bit in detail.
Yeah, I mean, really what we're looking at is really the trends in the cases across different regions, right? So it starts to tell us the overall incidence of infections. And really what it gives us is a bit of an idea of where we're starting to see hotspots in regards to high caseloads or emerging trends as far as increases. So, quite obvious to me is that when you look across at least British Columbia, that obviously in the northern and interior health regions, you are seeing, evidence of either increasing case numbers, which have not plateaued yet, or in the northern health region, things are plateauing, but they're somewhat maintaining at a high rate as compared to other regions of BC. And that's kind of been, again, it reflects back a little bit to what you were showing previously when we were looking at the US and the UK and Canada. Canada is well below the US and the UK, but whereas those two countries are starting to drop off, Canada, we're starting to see regionally more increased incidence in very specific areas. So I think we need to get a little bit away from just the overall trend, even just thinking from a provincial standpoint, and actually looking more localized to see where we're actually seeing those strong increases in cases, because now we have to start to think strategically about how to try and stop transmission in those areas.
No doubt, no doubt. So that being said, we're going to take a look here at a particular graph. So this is basically laying out the total vaccination rates in all these different locations. So in British Columbia, 76.6% of British Columbians are vaccinated with at least one dose against COVID-19. And we break it down per region. And of course, taking a look here at Northern Health, we're the lowest of all the regions. So we're still tracking a little bit behind. That's at least one dose. Just under 60% of British Columbians in the Northern Health region have received one dose, and 51.15% are fully vaxxed. So definitely quite a departure from the other health regions. And of course, we have a small population. We're spread out quite a bit, but we have a relatively small population, nothing like, of course, Vancouver. So again, when you see this, Jason, again, what is it telling you, but also what are some of the concerns and possibly what are some of the things that we still could do to see these numbers tick up?
Yeah, it's a great question, right? I mean, listen, I am just a very, very simple, mildly adequate virologist at best and not an epidemiologist. But, when I look at this, certainly when we look at lower vaccine uptake, what's the thing that we know right away? Well, we know that means that within that population, we have people that are susceptible to getting infected. Regardless, I think, of the age demographics, we have to be concerned about the fact that the virus can get in and it can certainly move within those populations quickly. So that's the biggest trigger to me. Is one of the easiest ways to try and counter that transmission is to try and increase vaccine uptake in those communities. Now, there's a bit of a difference. Certainly, you already referenced it. If you look into Vancouver, where I lived for a couple of years, we know that it's very population dense. So you have a greater ability for transmission within congregate living settings and within people that are in very close proximity. So you can counter some of that high transmission or potential for high transmission and lower vaccine rate by having some separation. But that only buffers you for a while, because unless you're maintaining complete separation from one another, we know at some point those interactions are going to happen, and it doesn't take much for this virus to transmit. So ultimately, it goes back to looking at the vaccine uptake and saying, okay, if we're needing to hit 85, 90% immunization rates to try and get a handle on Delta, we are well below where we need to be.
Now, turning to the next slide. So this is some data, some polling coming from the Angus Reid Institute out of Vancouver. Some of you might be familiar. The The question that they posed to respondents was, do you agree or disagree that proof of vaccination should be mandatory at public places in your community? So these are by date, so May 26th to July 20th and September 7th. And as you can see across the board, right across Atlantic Canada, Quebec, Ontario, Manitoba, Saskatchewan, Alberta, and of course, BC. Here's a total for Canada. We're seeing that as time goes on, we're seeing more and more people agreeing with that there should be mandatory vaccinations or proof of mandatory vaccinations in public places in your community. So about 72% of British Columbians believe that should take place. So, seeing that is encouraging, despite the fact that we're still here in Northern Health, of course, seeing a lower vaccination rate. Moving on to another slide, another question that was asked by respondents from the Angus Reid Institute. Suppose there's a person who refuses to show proof of vaccination at a restaurant, refuses to leave the premises. What would you like to see being done to that person? And 44% of respondents said that the person should be escorted off the property, but no additional punishment. And so I would kick this question over to Nathan. Who in particular, I know you've kind of touched upon it before, but who in particular will be removing that person? Will it be, the 16-year-old hostess at the restaurant? Or as you mentioned earlier, a manager? What if someone doesn't want to go? What are they to do to deal with that situation?
Right. So the first onus is on the public, that these are public health orders. They're not guidelines. They're not recommendations or suggestions. They're orders. We have other public health orders that are the rules in terms of engaging with, society in a meaningful way. So outside of those that are seeking, just to disregard whatever rules and laws they wish, there is a group of people that way. But for most people, the onus is on you. If you are not vaccinated and you want to go eat at a restaurant, you'll have to get takeout. That's the rule. There are fines associated up to almost $600, $575. And in terms of the enforcement, when you come in to your coffee shop, you'll have your vaccine card either on your phone or a printed version, and your ID, just so that your vaccine passport matches that. On big events, which we don't have necessarily a lot of up in Skeena, concerts, Canucks games, those types of things, there's a QR code, that little black and white squiggly code thing that comes up, people will see sometimes. They'll have a way to just simply, there's an app that will allow businesses or large events to just simply scan the code. All that is on your vaccine passport is your vaccine status. That's it. That's your name and your vaccine status. No other health records. When the local business scans that card, that's all they learn. No vaccine, single dose, double dose. That's it. And the information doesn't stay with the business owner. Once the scan is done, it deletes off. And in terms of enforcement, from conservation officers to police officers to liquor inspectors can give out those fines. And again, if anybody is being verbally abusive and all of those other things, we have laws, very good laws in place, and very good ways of dealing with people who want to be belligerent on some poor staff person that is saying, sir, you are too drunk, or you can't come in here in your underwear. Like, there's belligerence all the time. And I know the energy is up right now. There's a tension that's going on with these things. I think we'll settle into it. The number of places, Dan, that require a vaccine passport are few. The number of things you can do without a vaccine passport are many. And I just remind people they can go to the grocery store, pharmacy, church, on and on and on. Like, it'll take us the rest of your show to list all the places that don't require the vaccine certification card. The ones that do are the places that we're worried about transmission. And these are public health orders. They were put forward by the Public Health Office, and we should respect them. And I think the vast majority of British Columbians will do exactly that.
Just a quick follow-up on that. Does the government foresee having to change those requirements if they start to track outbreaks in some of those places that currently are not going to require a proof of vaccination?
As I said before, in all things will be led by the experts. And if they tell us there's a concern with this, we are trying to limit this right? To allow people to make sure they can go get their groceries and their medicine, and if they choose not to get a vaccine. Again, vaccines are overwhelmingly effective in trying to beat this virus back, and they're our best tool. It could be revisited, but I don't anticipate that right now. But I didn't make these orders. We are simply supporting them and think that they're the right thing to do. Look, I can remember when we, as a province, went through the smoking indoors debate as to whether you were allowed to smoke at bars. And I can remember people saying this is an infringement on their civil liberties. They want to be able to smoke. They always smoked. And maybe secondhand smoke causes cancer. Maybe it doesn't. And we debated that thing for 20 years plus until we realized that if you're working in a restaurant or a bar, secondhand smoke can give you cancer, and that those workers should be protected too. And there was great doom and gloom that every bar and restaurant in British Columbia was going to go under, was going to go bankrupt, ignoring the idea that there were some people who might come to your restaurant and bar if they know it wasn't filled with smoke, that they could bring their kids, that they themselves wouldn't smell like an ashtray afterwards. And we adapted and we got through. I think there's a large percentage, 77% of British Columbians are double vaxxed. I think one of your charts was a little off in terms of timing. Of the 77% who have already gotten fully vaccinated, I think there's a healthy contingent that will feel more assured going to a restaurant, to the cinema, to the gym, knowing everybody in there has also been vaccinated or is staffed and wearing a mask. So I think we're ignoring some parts of society that are in the polling and everywhere else are very pleased that this is taking place.
Well,
and I'm hearing that from, I'm sorry, last thing, I've just got a phone call from some local doctors up north that are wanting to say, as people working in the medical system, we are fully supportive of this taking place because everybody in our hospital with COVID right now is unvaccinated. And it takes, what are the rates that we looked at just recently in terms of the cost on the medical system? For someone who enters into the hospital with COVID is $23,000. A heart attack is $8,400, right? If they go into ICU and have to be put on life-keeping care, it's up to $50,000. I know we're not talking about money only, but there are people who are concerned about what this thing costs. And COVID is incredibly painful emotionally and physically, and it is also painful on our healthcare system.
Well, but I was going to add in, and really what Nathan just said very, very eloquently was this idea of the toll on the healthcare system. And I think one of the things that we have gotten very focused on, and certainly as somebody that works on pandemics and epidemics and marketing viruses, we always talk about case fatality rates, and we always talk about mortality. But one of the things that we tend not to discuss as much is morbidity, this idea of how sick does somebody get? And from a symptom standpoint, how severe are those symptoms? Well, what have we seen with COVID? We've seen certainly as that age has started to trend downwards, where we've had more protections for people that were in high risk groups, that now what we're seeing is we're actually seeing a shift where, yeah, there's younger people that are showing up in hospitals, but you know what? A lot of those younger people are not dying. And that's a great thing, but there's also the aspect that they also require longer care. So once those people end up in hospital, this is not something where they're in for a couple of days and they're released and everything goes back to normal. So now we start to think about the toll on other systems. We start to think about other diseases and other ailments that people cannot get care for. Certainly, from my perspective, having been in West Africa during 2014 during the Ebola epidemic, this is exactly what we saw. Ebola was one aspect, but what it did, it stopped us being able to provide care for people that had other ailments as well. So the longer this carries on, the more that we actually are increasing the risk for people that have other non-COVID related issues as well. So it's a continual strain that we need to get under control as quickly as possible. The rest of the world, certainly low and middle income regions, we're talking at least a couple of years, probably 3 to 5 years before we can get things under control because of the lack of vaccine access. Here we have a chance to try and get control of transmission, but ultimately we're not going to be completely safe till we get everybody taken care of. And that's going to be a much larger effort, but we have to start with getting things figured out here.
Just one quick thing, and I know it's not necessarily your research, Jason, but we knew when we had to go into lockdown because COVID was dramatically spinning out of control and people were not able to visit their elders in long-term care. They were not able to, businesses shut down, people were isolated. there was a huge mental cost that many
Yeah.
people who are now arguing against the vaccine certification and vaccines in general wanted to point out, and that was accurate. So the same folks
Yeah.
that are protesting my office, and free speech, power to them, that worried when we were in lockdown about the untold damage being done to us as a society by having a lockdown, is the exact same thing that we are trying to avoid with this, because that is a very difficult cost to get ourselves around. Never mind all those surgeries that are put off when your hospital is overrun, all that treatment that is not brought because your waiting time is now extended. And we all have stories of people who are due really important surgeries and the hospital just can't take them and saying, you're going to have to wait. And the stress for that person and their family is incredible. And we know that there's an effect that we're just not counting, I guess, Jason, was my point, is like, those numbers are how many more people died because their surgeries were put off, or their quality of life was dramatically reduced. And here we have an option. And so if I could sell you a car that had such safety systems in it that 90-something% of the time, if you were in an accident, you would just be untouched. It's not going to cost you anything. It's free. I'll just give you these enhancements to your vehicle. Most people would take them to keep themselves and their kids safe. In a sense, when we're offering a vaccine, we're saying, here's something that the proof tells us will keep you and your family much safer, much, much, much safer. And it doesn't cost you anything. Just come in and get a jab. And
And at the end of the day, I mean, when we look at these vaccines, what have we seen? They've gone through clinical trials. Certainly, the oversight and the scrutiny that these vaccines have been under through that process were the same, and if not greater, than what we've ever seen with other therapeutics that were approved. But on top of that, we now have billions of doses that have gone out across the globe. So when we think about this from a safety aspect, these vaccines are amongst the most safe vaccines we have ever seen, based on the number of people that have gotten immunized. So at some point, we have to look logically at that data and say, yes, we may have been concerned about safety when we first heard about the vaccines coming out.
Yeah.
We're at a point now, we have to be accepting of the fact that they are safe.
It's not a head thing, I think, in a lot of cases. I think it's a heart thing, if I could say. Like, there's apprehension and there's concern for those that are choosing not to get vaccinated. And there's apprehensions when suddenly a vaccine certificate, pass shows up about. So, and it's a very emotional response, which I totally want to appreciate, acknowledge, and understand. And yet, 5 minutes talking to the spouse of somebody who either died or went into the ICU with COVID and had to be intubated, and what that's like to go and talk to your partner or your mom or your dad or your cousin, knowing that coming out of intubation is incredibly, they're likely to die. And those are also very emotional things for me and many people. And so there's a real desire I have to plead with people to just, as dispassionately as they can, look at the evidence and say, this is not an experimental drug. As you say, Jason, this has been administered to how many people now?
We've seen billions of doses, right?
Billions of doses. Its efficacy, its effectiveness is far higher than vaccines that we take for yellow fever or flu or other things. So it works. It's been tried and tested and approved by the various agencies. And the consequences of not doing it are real. They're not imagined. There's not a conspiracy. This is a real thing. And so I'm almost down on one knee pleading, have your questions, look at the evidence, don't follow conspiratorial rabbit holes into Bill Gates and Agenda 21. This is not that. This is about our friends and neighbors. So sorry, I got on a bit of a soapbox, but I guess I'm in politics. So that there's a thread of that at any moment.
Well said.
Keep it minimal. Keep it minimal. Christine, you have a great question.
Yeah, I think, just listening to the conversations, I've had very close friends of mine that were on the fence in terms of whether they should get the vaccine or not. And two of them have ended up in the hospital. One is ventilated as of today. And before she got ventilated, she did have a conversation with my sister and said, I'm so sorry I didn't get this done. I don't know what I was thinking. I just never got around to it. And the other person was also, you know, talking about, wasn't sort of informed and was talking about how this is fake and all of these pieces. And he apologized on his Facebook and said, you know, I lived it. I'm telling you, this is real. And I share those not to sort of, you know, make anyone feel guilty. I share those because those are true stories. And I think in the Indigenous community, it's been interesting. We have, you know, potlatches and feast at a smaller scale happening now. And, you know, people are, I think in the Indigenous community are being very respectful when they go into these settings with a limited amount of people. When we go into another Indigenous community, it's up to us to ensure that we are fully vaccinated and that we're not bringing anything to that community. So that's what we've seen in the Indigenous community.
The 93% of British Columbians in the intensive care unit right now, 93% are unvaccinated. People can certainly look at Facebook and start doing deep dives. I talk to anybody who's got a family member in the ICU with COVID who is unvaccinated and ask if a vaccine could have helped your relative friend not be on life support right now, would you have done it? And their leadership from First Nations communities, from First Nations Health Authority has been incredible from day one in terms of understanding the vulnerability of certain communities and showing the leadership to encourage their membership to get vaccinated if they can. And it's been proof that leadership matters, I guess. And we saw it in the States, how much leadership mattered, where we had a president at the time who said this is a hoax, and I think some people who didn't want to get vaccinated felt emboldened by the president in that case saying, you don't have to worry about this, it's going to go away. We saw it in Brazil, we've seen it, that leadership matters. And I'm proud of that leadership within our communities, and I really hope that to the municipal and faith leaders and cultural leaders that we have to look at the numbers and protect those you hope to lead. And by doing that, you encourage people to come out and encourage people to be kind to one another, even when we're disagreeing with one another. You know, don't shout at any servers. Don't shout at somebody at the gym. I know you're frustrated. Let's be good to each other, even when we're stressed.
Yeah, the only point.
Go ahead,
The only last point that I was going to quickly make was that, you know, I think it's also good to maintain perspective that we've seen this before. So the rhetoric has certainly notched up the last little while. There's a lot of negativity regarding vaccinations right now from a very vocal minority. We've seen this historically before. We've seen it through smallpox. We saw it through 1918 flu. We've seen it through a variety of other diseases. I saw it in West Africa during Ebola. This is not novel. I think the light at the end of the tunnel is we've always done better. We've been able to get through this. We've got to try and kind of, you know, tease out some of that rhetoric and some of that noise. We don't have a choice, and we have to be reliant on each other and reliant on ourselves to make good choices. We have the option to do it. I cannot implore people more than I do every day, but to say, please get vaccinated, get both doses. It is an absolute that we need people to do this.
We're just about to wrap up here, closing in on 6:30, but I just wanted to share quickly one word. There's been some questions about what's happening specifically here in the Bulkley Valley. If you go check out the CDC, BC CDC website, you can see all the data there. Currently, and this is coming from Northern Roots Primary Care, the cases that have been indicated on the maps of the local health areas on the BC CDC are a little bit behind because things are changing so rapidly in the last few days here. So currently there are 64 new cases between August 31st and September 6th. We're also seeing obviously some cases in the Terrace and Kitimat region, but in Prince Rupert, but much lower. And also they have higher vaccination rates. Kitimat is about at 80%. Prince Rupert is over the 75 mark. So clearly there's something going on there, people wanting to get vaxxed, and we're seeing the results in the lower caseloads. But I just wanted to point out, so the Northern Roots Primary Care is a group of doctors. They have a facility here, and they deal with a lot of patients. And they're asking people that the fourth wave has come to the Bulkley Valley. Obviously, there are some cases there, but they're also saying that if you do have symptoms, to stay home, follow the public health guidelines, and consider avoiding high-risk activities and going to the ER for minor issues while we try to help community through this current wave. So clearly the physicians here in our community, here in Smithers in the Bulkley Valley, and as well across the region, are asking people to be vigilant and to ensure that they do get vaccinated and they take care. We talked earlier that vaccinations alone aren't going to stop this. They're not going to save us alone. It's not a silver bullet, but it is another layer of protection. And over the last year, we've been talking about this over and over again. Mask up, make sure that you keep good hygiene, wash your hands, make sure to keep distance when you're in close confined spaces. And when you can, be outside as much as possible. All these things are layers of protection, just as, you know, we're getting ready for winter and layering up for the cold. It's the same idea. And if we can all kind of continue to do that, hopefully we'll find our way out of this business very soon, hopefully in the next few months as we head into winter here. And with that, I just want to say thank you to both MLA for Skeena, Nathan Cullen, and of course, Dr. Jason Kinrachuk from the University of Manitoba for joining us and as always, providing insight and your knowledge on this subject. Thank you to our audience for joining us again. This has been great. Also, there are some unanswered questions that people popped into the chat. So we will make sure to get those in touch with you, Nathan, especially, and you can respond to those questions. And of course, to my wonderful co-host, Christine Smith-Martin, thank you so much for keeping us on track and informed. As usual, it's always a pleasure. We will keep you informed if we come back to bring another episode 10, possibly of Fighting COVID in the Skeena. We will see how things go over the next couple of months. But thank you as always for tuning into skeenastrong.com. And of course, you can always check us out at skeenastrong.com and our Facebook page. Everyone out there, take care and be safe.
Thank you.
Thanks, everybody.
Thanks, everyone.
Take care.